The next presenter is Dr. Anu Rajpurohit from Jodhpur, and she'll be speaking to us on Ivonescimab in combination with chemo in patients with EGFR mutated NSCLC who progressed on EGFR TKI.
Thank you,
the
sir.
HARMONi-A study. Yeah, over to you, Anu. Sorry.
Thank you, sir. Good morning, everyone. I'll be talking on the molecule Ivonescimab combined with chemotherapy in patient with EGFR mutant non-squamous non-small cell lung cancer who progressed on EGFR TKIs. So this study was done in China and got approval there. So we all know that in EGFR mutant NSCLC patient, the upfront treatment with tyrosine kinase inhibitors is standard. However, the drug resistance remains a challenge, and now we are looking for the new effective therapy, and the answer we got by this molecule. So what is Ivonescimab? It is an anti-PD-1 and the VEGF bispecific antibody displaying cooperative binding characteristics. So already phase 2 clinical studies have shown the benefit in this group, and this study, which is phase 3, aimed to evaluate and confirm the efficacy and safety of IVO combined with chemotherapy compared to chemotherapy alone in this population. So this is HARMONi-A study design. They included non-squamous cell NSCLC, advanced stage 3, which were ineligible for the surgery or the local therapy, and the stage 4 EGFR sensitive mutation, ECOG PS 0 to 1, regardless of PDL1 expression. So they divided into two arms, Ivonescimab plus chemotherapy, which was pemetrexed carboplatin, and the second was placebo in combination with pemetrexed and the carboplatin. So treatment was given until the intolerable toxicity, no clinical benefit, up to 24 months. Primary endpoint was progression-free survival. Second is overall survival, response rate, duration of response, and time to response and safety. So 320 patients were included. All data except OS are based on the clinical data cutoff of March 2023, at which point the median follow-up duration was 7.8 months. So this is the study design. 501 patients were assessed for the eligibility, out of which 322 patients got enrolled, 161 in each arm. So these are the baseline characteristics. So the median age was the 60 years. 30% of the patients were more than 65 years. Half were male, almost half were female. The almost 85% of patients had ECOG 1. If we talk about the smoking status, 30% were the current or the former smokers, and 70% were the non-smoker. In 20% of the patient had brain metastasis. If we look at the EGFR mutation type, so almost 57% patient had exon 19, and followed by the EGFR exon L858R in 37%. And the T790 mutation status was in 16%. And if we look at the previous EGFR TKI treatment, in 60% of the patients received first or second generation TKI, followed by the third generation TKI. So these are the PFS result. We can see at the 6 months, it's 55% versus 33%. At 9 months, it's 37% versus 18 months, with hazard ratio of 0.46. Coming to the subgroup analysis of PFS, we can see all the subgroup got benefited. Here one point is noticeable, which is T790 mutation status. Those who were positive got better result, those compared to those who had negative. Coming to the PFS based on the 19 deletion or L858R, we can see both the group got benefit with the hazard ratio of 0.48 in 19 arm and the 0.43 in the L858R arm. So this is the PFS by the presence of brain metastasis. Even the patient who had brain metastasis, those also got benefit. So this is the overall response rate, 50% in the IVO arm compared to the placebo, which was only 35%. The median duration of the response was 6.6 months in the IVO arm and compared to the 4.2 in the placebo. So this is the overall survival at 30% of data maturity with the hazard ratio of 0.72. We can see at the 6 month the results are almost equal, but as time goes, the curve separates. At the 9 month, it is 77 versus 70%. Similarly, at 52% of data maturity, the hazard ratio is 0.8. We can see the graphs are getting separated. At 12 months, it is 65% versus 59.8%. Coming to the safety profile, we can see the almost all patients showed some form of toxicity. If we look at the grade 3, it is 54% in the IVO arm compared to the 42, which is placebo. Serious event happened in 28% of the patient in Ivonescimab plus chemotherapy arm, but no death happened in any of the group. So these are the most common side effects. So most were the cytopenias, whether it's decrease in the WBC counts or hemoglobin or neutrophil, followed by the increase in the liver enzymes, followed by the GI symptoms like vomiting, decreased appetite, constipation. If we look at the immune-related adverse event in this arm, so it happened in almost 1/4 of the patient, but grade 3 happened only in 6%. And the most common were the abnormality in endocrine system, which is thyroid, followed by the pneumonitis, dermatitis, which we expect with the immunotherapy. So this is the adverse event of special interest. Some patients showed some form of hemorrhage, but they were not serious. So coming to the conclusion, so Ivonescimab plus chemotherapy significantly improved PFS in patients who progressed on prior EGFR TKIs with hazard ratio of 0.6, and all the subgroups showed the benefit, and the safety profile is manageable without any unexpected adverse event. This study is now being expanded globally, so we are waiting for the result in another part of the world. Thank you.
Thank you very much, Anu. Nice presentation.